Dr. Harford Joe, whom we know from yesterday in details. He's from NIH from US. He will talk about palliative care in Muslim majority countries. Please, Dr. Harford, thank you.
Well, thank you. In the interest of full disclosure, I will tell you right up front that I did not grow up in a Muslim country. But I had a very able colleague who helped me on this project, which is Ms. Deena clinical nurse coordinator at King Faisal Hospital in Riyadh. And I got interested in this topic primarily because of the relationship between economics and palliative care. And it turns out that there are 49 Muslim majority countries in the world. Muslims obviously live in every country in the world, virtually. But there are 49 countries that have a majority population of Muslims. And that the interesting thing is that they range from the richest countries in the world to the poorest countries in the world. And so you can sort of look across that. Some of the findings were rather surprising, and I'll present those to you. Let me start by echoing something that was said earlier in terms of the need for palliative care. I often point out that the three most significant features of cancer in Muslim majority countries are number one, late diagnosis, number two, late diagnosis, and number three, late diagnosis. And what this means, among other things, is that palliative care has a bigger place in treating cancer in countries where late diagnosis is common than if you had early diagnosis. Okay. Let's quit working. The slides have frozen. Does it work to just keep doing the same thing over again? Actually, the interesting thing is Einstein's definition of insanity was doing the same thing over and over again, but expecting different results. Okay, thanks. Okay. So the implication of this is that we need more and better palliative care in countries where late diagnosis is common. This is the WHO model for palliative care. And I just want to point out a couple of things as it relates to this section on pain. One is the key aspect of drug availability. And the second is the starting point of a situation analysis. So really what I'm doing here today in part is conveying to you a situation analysis. Now to emphasize this issue of stage, you can see here, this is using breast cancer as an example, and this is data from the U.S. I'm declining. I'm not taking any calls right now. Okay. Oh, they want to hear me? Okay. All right. And this is the data from Gurbeya in Egypt, the city of Tanta. Answer with the video. Answer.
You come in like this.
Okay, and these are data from the United States, which just makes the point of how important stage is in terms of cancer survival. So this is looking at cancer survival, your 5-year survival, for all these different cancers, looking at either localized, region, or distant disease. And basically, the bottom line is that if you have late-stage diagnosis, you have much poorer survival in all cancers that you want to look at. And again, this is US data where treatment is reasonably good. Now this model is quite a bit more complicated than it first appears, and again, because we're talking about pain this morning, with this aspect of drug availability, the opioids, the importation of them, the cost, the prescribing, the distribution, the dispensing, the administration. All of these issues have to be dealt with in terms of effectively dealing with pain. Now, the question becomes, how do you measure a country's palliative care activities? What are the metrics for palliative care? And I'm suggesting that there are 4 related to pain control as well as service. Now, I want to say from the outset that pain control is not synonymous with palliative care. Palliative care is much more than pain control. But pain control is an area where we have some data. And so I'm always looking for data. And so pain control gives us that handle on palliative care. So there's the term is called morphine equivalence, which just means all forms of opioid analgesics. The Human Rights Watch, Dr. Fuda mentioned yesterday in his talk that access to pain relief is a human right. In fact, the Human Rights Watch people would say denying pain relief is tantamount to torture from a human rights perspective. And so I'll show you some data on that. And there's a very interesting paper that appeared in 2011 where they actually were measuring for the first time the need of each country for pain control and then comparing that country's consumption to the need, and it was called adequacy of consumption, and then just an enumeration of services and levels of this. So let's start by talking about morphine equivalence. And you can see here that, as I said before, there's a lot more to palliative care. These are symptoms of breast cancer and lymphoma. But you see that 30% of these patients, again from the US, are reporting severe to moderate pain as a result of having breast cancer or lymphoma. And it's similar for other cancers as well. Now, pain, in this slide, you also see this thing called distress, which is, again, 30% of the patients are reporting severe to moderate distress. And what's meant by distress is total pain. So physical, emotional, psychological, spiritual, and social pain. And patients experience all of these as they approach the end of life or have a life-threatening disease. There's not a lot of data available from Muslim-majority countries about symptoms, but my theory going in is that the symptoms are similar in most places. This is a very small study from Kuwait, where again, 80% approximately of the patients in the study were reporting pain. And so I think that that's something that we need to be aware of. Morphine is effective and not expensive. I mentioned the economic aspects of this, and there are various forms of morphine. I mentioned that pain control is not synonymous with palliative care, but if you think you're doing palliative care and you're using no morphine, then you're kidding yourself. The WHO says you cannot be doing palliative care unless you have adequate access to morphine. Now, this is the worldwide opioid use. It's data that was compiled by the World Palliative Care Association. And you can see the ranges here are quite large, with the US using over 100 milligrams per capita, and some countries using less than 1. Now, this is another way of looking at that, and this gets back to the economics I was mentioning. This is the GDP of the country on a log scale. And this is the opioid use, all forms of morphine. And you can see that below a GDP of about 10,000 US dollars per year, virtually no opioid is used. And then as you start to go up in GDP, you start to go up in morphine consumption, roughly. But the thing that fascinated me about this data are all of these countries down here, which have high GDP, but low morphine use. And so you can ask the question, well, what are those countries? And among them are Qatar, Kuwait, UAE, Bahrain, Oman, Saudi Arabia, the countries of the Arab Gulf that have GDPs equivalent to the US or higher, but are still not using morphine. So the question is, why is that? And this is where this study is taking us. Now, I mentioned that there are 49 countries. Dr. Fuda mentioned the Arab League, which is only one part of the Muslim majority countries of the world. actually the largest Muslim majority country in the world is over here, Indonesia. It's not an Arab country. But these are, in the green here, are all the countries that we looked at the data for this survey. And this is a blow-up of the that portion of the map. And again, red, for simplicity's sake, red is bad, green is good, and these are the ranges in between. And you can see that there's a lot of red on this map. And if I overlay which countries are Muslim majority countries, you can see that many of them are red. The country that's doing the best in the Muslim majority world is Turkey here, and Jordan is in the 1 to 5 range in this. In the most recent data, Jordan has just barely creeped above 5 milligrams per capita, and I'll come back to that. Now, how about access to pain relief according to Human Rights Watch? Well, this is their map, and they're looking at overall access to pain relief here. And they're using, again, all forms of morphine. This is the blow-up of that. There's some things that jump off the map here. Actually, some analysis of morphine use omit the form of morphine known as methadone. Methadone is used in drug rehabilitation in addition to pain relief. And you can see that Iran is rated very good. This is almost all methadone. Okay. So if you exclude methadone, Iran doesn't look so good. But again, if you look at all of the countries that are here, you see in the Muslim majority countries that once again, they're all the wrong color, or not all the wrong color. And again, Turkey, and in this case, Jordan, Saudi Arabia, Tunisia are doing reasonably well, but not still quite limited. If we look now at this adequacy of consumption measure, which I think is a very good one, because it, again, looks at need in addition to use. Up to now, I've just been showing you use, but what about need versus use? And they came up with this number, single number, and I think I just want to point out that moderate consumption is a number of 0.3 to 1, low consumption 0.1 to 0.3, very low consumption under 0.1, and virtually non-existent consumption relative to need is a figure of 0.03. And if you look at the WHO regions of the world, this is the Americas, and it includes Canada and the US, who have adequacy of consumption measures that are above 2 on this scale. And then if you look at all of the other regions of the world, only Europe manages to get into the moderate consumption. And here is IMRO, which covers most of the Arab world, and they're below moderate, below low, and into the very low consumption measure. If you tease this out a little bit more and say, well, how about the 15 largest Muslim majority countries? You get this data. So as I said, Indonesia is the largest Muslim majority country. I've ordered these in terms of how well they do on this adequate consumption measure. And Turkey and Saudi Arabia barely make it into the very low consumption. Again, the scale here, I find this to be quite disconcerting. On this adequacy of consumption measure, remember that the U.S. number is 2.48, and these numbers are 0.07.